Hi, I'm Dr. Janaina Koenen. I'm a medical endocrinologist, and today we're going to have a talk about metabolic ketogenic therapy for cancer. So now you know my story. If you don't know, please go back to the first video in which I tell my story, why I'm talking about cancer here. It's very important. You know this person who's talking to you. I think it's important. So anyway, cancer is a metabolic disease. It's not only a disease of a mitochondrial deficiency, as some doctors say in the literature and in the social media, but actually it has lots of metabolic aspects, and we must address them all in order to treat cancer. So, for example, sleep is a very important thing in cancer that we have to address. It's so important that people who work in shift works, they have more cancer. Nurses have more breast cancer. And it is related also to a melatonin deficiency and a circadian rhythm deficiency or malfunction. So when you have cancer, you want to treat cancer, people should sleep well. They should sleep early, like before 10. Usually I supplement melatonin, not only for sleeping, but we'll see later that melatonin has a very, very interesting role in cancer treatment, not only orally, but intravenously as well. And that's something I do here in my clinic. But sleep is something really important. Physical activity is very important, especially resistant activity like weightlifting, Pilates. Why? Because the lean mass is a parameter that we must look after in cancer treatment. The more lean mass you have, the less lean mass you lose during your treatment, the more you will have of survival rates. So the more you will live. It's important that we preserve muscle mass in cancer patients. Cachexia itself is a risk factor for dying prematurely for cancer. So we always tell the patients, do whatever you can. Physiotherapy, Pilates, weight training at home, functional exercises, you know. And you can also do the aerobic part as well, like swimming, walking, running if you can, because patients in chemotherapy, they're very tired, so they have this difficulty doing intense training. But it doesn't have to be intense. It has to be what you can do. If you can walk, walk. If you can do physiotherapy, please do. And it's very important that you do something like a resisted exercise for preserving muscle mass. So sleeping, physical activity, stress management is very important. The stress management is so important that when you see patients that they feel they're going to live longer, they're not pessimistic, they're optimistic, the studies show that they are indeed living more than the pessimistic patients that say they're going to be dead in a year. Elevated cortisol. Elevated cortisol makes you lose muscle mass, makes your glucose rise, makes all your hormones be unbalanced, and this makes your immune system don't work well, so increases mortality. So stress management with meditation, mindfulness, yoga, anything you can do to manage your stress, to be calm, to be optimistic, may help in your treatment. And this is no hocus pocus. This is science. It's written, it's published, you can look it up, okay? And what can you do about the rest? So cancer as a metabolic disease has many aspects. One of the aspects is energetics and how it grows. Usually when you have an aggressive cancer, it uses a lot of glucose to grow. Not only glucose, but other substrates like glutamine and some fats, okay? So the cancer cell has to divide, okay? It has to make another cancer cell like this, with a membrane, with a nucleus, with DNA, okay? With organelles. So you need structure, okay? So you need to produce protein as well and DNA, and you have to produce the lipid bilayer of the membrane, so you need fats, okay? So this is for structure, but cancer cells, they actually also need energy. And how do they make energy? Most of cancer cells, especially the most aggressive ones, they use lots of glucose. It's not because their mitochondria don't work. It does. We have many studies showing that cancer has a flexibility, a metabolic flexibility. The cancer cell can do phosphorylation, can do glycolysis, oxidative phosphorylation, and glycolysis. It depends on the oxygen available. It depends on the aim of the objective of that time. For example, if you need to produce more lactate. Why more lactate, Janaina? Because lactate is a messenger in cancer. Lactate is used for many, many things. One of them being blurring the immune response. So blunting the immune response in a way that your body doesn't see the cancer growing. We call this like a mask. Cancer has a mask. So your immune system can't see it. So lactate works and participates in this. Lactate also acidifies the extracellular environment of the cell, which is very important for metastasis. So when you have a cell doing glycolysis and producing loads of lactate, you know this cancer is aggressive. You know this cancer is highly metastasizable. I don't know if I said it right, but it has more chance of metastasizing. And you know the prognosis is worse. We have many studies showing that if a patient has high lactate levels, he dies more. If lactate dehydrogenase, LDH levels are very high, we have a worse prognosis. So there are many, many studies showing us that some metabolic markers are important. We just didn't know why they were so important. But now we do, or at least some of us do. I don't know why not, why the oncologist is not talking about this. So when I see a patient that has high lactate and low pyruvate levels, and we can make a ratio, lactate-pyruvate ratio, and we can look at it. If we have high lactate and low pyruvate, we know that this tumor is doing a lot of glycolysis. This tumor is producing a lot of lactate. Can we do anything to disrupt this? Can we do anything that could get into the way? Yes, we can. So we have dietary approaches, we have supplements, we have off-label drugs. And like this, we have a different picture because you have chemotherapy, radiotherapy, immunotherapy. They usually work in stage 1, stage 2 patients. In stage 3 and 4, they don't work so well. Cancer gets resistant. And how can we treat them then? Usually we don't, right? We just change the medications and we try to prolong life as long as we can. Okay? It's very important. But what if we had a metabolic strategy that would approach all these mechanisms in cancer that are not being looked at, no one's looking at them? What if we could sensitize the cancer cell to chemotherapy or radiotherapy? What if we could protect healthy cells from radiotherapy with a dietary intervention? Would it be possible? Yes, it is. So nowadays, we know, for example, that ketogenic diets, they protect healthy cells and intensify the radiotherapy lesions in the tumoral cells. We know that for a fact. We have lots of papers published about this. We know that ketogenic diets can preserve muscle mass in patients, even terminal patients. And this is published in randomized clinical trials. We have the KetoComp, for example, in many types of cancers, showing the ketogenic diets preserve muscle mass. Ketogenic diets, they improve quality of life, well-being, sense of energy of patients. They reduce the chemotherapy side effects. Why isn't anyone talking about this? I don't know. Well, I am. I'm here right now. And I invite you to follow my posts, to see the papers I'm going to post, and to see the science behind it. Because I know we don't have randomized clinical trials for everything, but we always must work with the best evidence we have. Sometimes the best evidence we have is an observational study, okay? What is unacceptable is oncologists telling patients they can eat whatever they want and it won't make a difference. You know why? Because it will make a difference. It does make a difference. And we have solid literature about it already, at least to make it arguable. At least for them to say, okay, we might have something here. And not what they used to say. They're always sure when they say, no, you can eat whatever you want as long as you don't lose weight. That's not correct. And I'm going to show this to you here. I invite you for a healthy scientific discussion about ketogenic diets and cancer, low methionine diets and cancer, which is another diet, we can talk about it later, and about supplements, modulating metabolic pathways. So I invite you to watch. I have a podcast on YouTube. It's called Metabolic Podcast. I already have some videos there. You can watch an interview I have there about this. And I'll be recording more videos, okay? I'm not English, I'm not American, Brazilian, so my English is not perfect. But I decided to record and to talk about this here because I think this is so important. I can't keep it to myself and only talk about it in Portuguese. So, be my guest. Bye-bye.